My name's Bertie Squire. I'm a Senior Health Advisor part-time at the Department for International Development. There is a big focus this year on tuberculosis because it is now the infection that kills more people around the world than any other. So in the latest data that we have from 2016, there were an estimated 10.4 million new cases of tuberculosis and 1.7 million deaths. The current rate of decline will only see the epidemic end in about 150 years. So there's a recognition that more needs to be done if we're to make the kind of progress necessary. Multi-drug resistant tuberculosis contributes between 1 in 3 and 1 in 4 deaths due to antimicrobial resistance. And antimicrobial resistance was itself the subject of a United Nations high-level meeting in 2016 with a declaration. So there's a clear synergy between these two huge health threats. So in terms of preparation, there's been a first ever Health Ministers Summit on tuberculosis, where the health ministers from around the globe gathered in Moscow in November 2017. And there have been discussions around how globally we can come together to make more progress on TB, really building now with the civil society hearing and other things towards the high-level meeting in September this year. There's a great need for everyone who's involved with tuberculosis to work much more closely and much more effectively. And that means bringing civil society groups together, non-governmental organisations, people who've been affected by tuberculosis, professional and academic communities, health service providers, product developers, the pharmaceutical industry. Actually, we really all need to wake up to the fact that this is something that if we collectively put some focus on it, we have a chance to make a difference. One of the challenges we face with tuberculosis is that it's a disease that's been with humanity for such a long time that we no longer think of it as a health threat. So it's quite different from, for example, Ebola, for which we've seen massive progress with people coming together and research, developing a vaccine in record time. But because tuberculosis has been with us and insidious and affecting people in poorer sectors of society, poorer populations, we really haven't had this opportunity to build momentum around it. In terms of research, it's really clear that we need investment across the whole of the spectrum of research. So this is from basic science to develop new molecules and approaches that will form the basis for the development of very much needed new vaccine, new diagnostics and new drugs. We desperately also need research that is called applied health research, which really encompasses operational health systems and implementation research, which really enables the best use of existing tools in health systems and will enable the new tools as they become available to have maximum effect in societies and to reach the poorest populations. Along with that, there's a strong need for an applied health research investment in order to help with health systems strengthening. Tuberculosis control is integrally dependent upon health systems that are able to recognise tuberculosis cases, get them onto treatment quickly and ensure that they are cured so that they don't transmit the disease any further. The World Health Organization published a report on investments in TB research and development. In that report, it's clear that the UK is second only to the United States in its overall investment in absolute terms in tuberculosis research and development. It also showed that the UK is spending more than any other country in the world as a percentage of its gross economic budget for research and development. So in many respects, the UK is a big player in research and development for TB. It makes big investments in the Global Fund against TB and malaria. And if you take all of the UK's investments, you'll see that they contribute across the whole spectrum of research through to implementation. The WHO End TB strategy includes a goal for eliminating catastrophic costs incurred by patients in seeking care for tuberculosis. That goal is not really going to be achievable unless there's a clear focus on social development and social protection alongside efficient and patient-friendly implementation of diagnosis and treatment for TB.